Good evening, guys. I've got discussion B for you. We're discussing elder or people that go through foster care as in childhood, and then they end up um, as elderly folks with institutional settings for placements and things. Well, and the trauma they go through, relived experiences, be it because of childhood, past things that happened to them and things. We're going to discuss their elder care for tonight. In Australia, they're called care leavers. Now, these are adults who spent part of their childhood in orphanages, children's homes, foster care, or other out of home placements, perceived and experienced today's aged care services. These these individuals, often referred to as forgotten Australians, carry lifelong imprints of early institutionalization. As they age, many confront the unsettling possibility of re-entering institutional environments. The echo past trauma. The review synthesizes Australian and in international literature and finds a consistent theme. Older care leavers overwhelmingly prefer to remain in their own homes where familiarity, autonomy, and emotional safety are preserved. Key findings and themes. Preference and preference for, preference for home-based support. The review highlights a strong desire among care leavers to avoid residential aged care facilities. Home represents continuity, control, and a buffer against the distress associated with institutional settings. That may resemble the environments where they once experienced neglect, abuse, or disempowerment. Heightened vulnerability because their childhoods often involved instability, separation, or trauma. Older care leavers may enter later life with heightened sensitivity to authority, surveillance, or loss of autonomy. Professor Philip Mendez notes that this group, particularly vulnerable and their early experiences shape how they interpret aged care environments and interactions. Importance of voice and diversity. The authors emphasize that care leavers are not a monolithic group. Their experiences vary by era, placement type, culture, background, and personal history, incorporating their voices into research and policy ensures aged care systems respond to real fears, preferences, and needs rather than assumptions. Why this matters for policy and practice. Understanding older care leavers as a distinct population challenges aged care systems to move beyond standardized models. Many traditional residential care settings unintentionally replicate aspects of institutional life, rigid routines, shared spaces, limited privacy that can trigger distress for people who grew up in similar environments. Trauma informed, person centered approach becomes essential. Policies that expand in home care strengthen continuity of caregivers and ensure choice and control can significantly reduce anxiety and improve well being. Moreover, involving caregivers in policy design helps ensure reforms address the emotional, cultural, and psychological dimensions of aging, not just the logistical ones. Practical implications for aged care providers adopt trauma informed policy or practices. Staff should be trained to understand how early institutional experiences can shape trust, communication, and behavior. This includes recognizing triggers, offering choices, and avoiding practices that feel uh, puntive or inf- infantilizing. Prioritize home support options. Providers can expand home based services such as personal care, domestic assistance, case management, and community nursing. Flexible scheduling and relationship based care help build trust. Engage care leavers in planning, co-designing programs with care leavers ensures services reflect their histories, culture, and identities and preferences. This might include advisory groups, peer-led consultations, or storytelling initiatives that inform staff training. Create emotional safety environments, even when residential care is necessary. Providers can reduce institutional feel by offering private spaces, personalized routines, and opportunities for meaningful connection. Limitations and research gaps noted or implied. Because the article summarizes a uh, lecture review rather than presenting new impar, impar, impartial data, its conclusions depend on the availability and quality of, of existing studies. The review suggests several gaps: limited compens- com- contemporary research on older caregivers, especially those from diverse cultures, backgrounds, and more recent foster care systems. A need for evaluations of specific interventions, such as trauma informed residential models or enhanced home care packages to determine what truly improves outcomes. Insignificant um, longitudinal research tracking how early institutional experiences shape aging trajectories across decades. A lack of uh, international competitive studies that could reveal how different care systems support or uh, frail care levers as they age. Older care levers experiences remind us that aged care is never just about services. It's about memory, identity, and the emotional landscape people carry into later life. Now, here's the question, guys. What part of this topic would you like to go deeper into? Trauma informed care strategies, policy reform, or the lived experiences of caregivers themselves? Now, those are some show ideas. So, with that being said, people can leave me some ideas about uh, shows that I can do on that match this topic, or things of that nature. So, Guys, you can help me out with a second show for this. Give me an idea as to what you guys want to see from this series, and I will see what I can do about putting show notes together for that topic. With that being said, Gator Wellness, take care, folks. I'll see you tomorrow for shows.